मैं नॉन-वेज
पगला हो गया। मेरे को आते ही बोलता है, मैंने कहा खाना दे दूं क्या? हाँ दे दो। भूख, मैं तो लगा इतना टाइम लग गया तो डेफिनेटली भूख लग गया होगा। तो तो चुपचाप आते ही खाना खाने पड़ी। बोला हाँ दे दो। मैंने कहा ठीक है। ज़्यादा कह रही थी, मुझे पता है तुम भूख के हिसाब से, और कुछ इसीलिए मैंने और कुछ था ही नहीं। मैंने कहा चल आलू का सब्जी पूरी। मैंने इसको फ़ोन किया था, ये बोला अभी देरी है मेरे को। तब फिर हम लोगों ने खा लिया था खाना। हम लोग खा लेते, ये जब आएगा तो खा लेगा।
हाँ मतलब मेरे को अभी तक देखा भी नहीं था।
तब तक बुलाया भी नहीं था। बुलाया था कितने बजे? कब तुम 11:30 बजे उधर पहुंचा? 11:30 बजे
तो लाइक 12:30 12:50 अंदर गया।
12:30
मैं तेरे को तो फोन 1 बजे के बाद की थी।
वो नहीं, पहले वाला हो गया था मतलब।
हाँ, एक बार
दूसरा नहीं, दूसरे वाले को दिखाया था।
सेकंड राउंड अलग अलग रूम्स में जाना होता है। एक बार वो पावर चेक करते हैं।
पावर चेक वाला पहले हो गया।
हाँ, पावर चेक सबसे पहले करते हैं।
तो बाहर बैठे थे, फिर तुमको ड्रॉप्स दिया।
वो फिर सिस्टम
I got strong hair. Colgate Strong Teeth এখন মিন্টিও পছন্দ। এই পাহাড়ে লাস্টে চলে গেছি কি করে? লাইট ফিল করছে আর লাইট দিয়ে এতে আছে চিনি।
Good evening, sir.
मेरे को टाइम दे दो Good evening, everybody. Welcome to the National President and the National Secretary.
Thank you.
Welcome, ma'am.
Thank you.
Today we are organizing basically. Welcome, Dr. Anurag, National Secretary, WISSP.
Thank you.
So, on behalf of West Bengal Society for Study of Pain, we are today organizing a awareness program of the non-pharmacological, non-interventional music therapy, yoga, and other mindfulness in the and its utility and these modalities, their utilities in the management of chronic pain as well as palliative care. So we have got three esteemed speakers. I'll hand over to Shiny ma'am to introduce the speakers. And from there on, we'll take up the discussion once the speakers have said. Shiny ma'am.
So before going to introduce the speakers, so I'd request as ISSP President Madam Krishna Madam is there, and Honorary Secretary ISSP Dr. Anurag Agarwal is there. So for everybody, there's so many common people are also watching us on our YouTube channel. So I'd request Krishna Madam to please give one welcome address from national level also, and followed by Dr. Agarwal will say something for everybody. So handing over the mic to Dr. Krishna Poddar Madam.
Good evening, namaskar to everyone. I welcome you all. This is very good initiative from my own West Bengal Society for Study of Pain, that we are having this awareness program. See, chronic pain is the condition where, of course, we pain clinician have many things to do, but sometime you feel your intervention or pharmacological management works, but patient has the other factor also, like psychosocial factors, which we have to address nicely. And for these things, I think musical therapy, yoga therapy, these things are very, very helpful. And today we have the CMA or webinar on this. And I appreciate this subject has chosen, because we always talk about the our intervention or pharmacotherapy diagnosis, but we actually these which are the very essential treatment methods we don't talk. So this is very good initiative, Devulina. I congratulate you for taking this uh, initiative, and I welcome you all for this webinar, and I request Devulina to start the webinar after secretary's address. Thank you. सुना जाता है?
Unmute yourself.
Your mic.
Thank you, Madam, for your continuous motivation. And now I'd request Dr. Agarwal to say something for the audience.
Thank you, dear Dr. Devlina. Well, I welcome all the esteemed panelists as well as the guests, especially our Honorable President, Dr. Krishna Poddar ma'am. I can see Dr. Sukhdev Nayak is also here. He has been my teacher as well. And Indian Society for Study of Pain believes in the wholesome care for the chronic pain patients. Though our niche is MIPCs, our ability to do the MIPCs, different MIPCs, minimally invasive pain and spine intervention, but we certainly believe that no size fits all. And there are multiple factors which are not physical and which cannot be treated by our MIPCs or the pharmacology alone. There, all these additional therapies like music therapies, yoga, mindfulness, they are amazingly useful for many of our patients. So it is a very pertinent topic you have chosen. For that, I congratulate the West Bengal Society for the Study of Pain, the West Bengal chapter of Indian Society for the Study of Pain, so that all our members can be benefited. That where we can find the help for our patients for these therapies, and how can they be they are enhancing the effects of what we usually do in our day-to-day practice. So with these words, I'm not taking much of your time. Thanks for having me here, inviting me here as a participant. I'm certainly looking forward to learn many things new, which are going to help all of us. Thank you. My best wishes. Thank you.
Thank you, Dr. Agarwal, for your kind words. So I am handing over the mic to Dr. Shani Mukherjee. Before handing over, I must introduce my two moderators also. Dr. Sanjay Patwari is the Vice President of West Bengal Society for the Study of Pain, and he is also a very senior pain physician. And Dr. Shani Mukherjee, she is again a multifaceted talent. She is anesthesiologist, pain physician, and musical expert, and definitely a good writer. And she has taken a very good enthusiasm to conduct this program. So I appreciate that. Thank you, and I'm handing over the mic to Dr. Shani.
Good evening, all. Good evening, all the. I have seen many senior pain physicians from the national level also have joined us. Thank you, sir. Thank you, ma'am. Today we are going to discuss a very interesting and pertinent topic. Thanks to WBSSC for choosing this. Our topic is role of yoga, mindfulness, and musical therapy for pain and palliative care patients. Today we have eminent panelists who are working for a long time successfully in these fields. We are fortunate to have our first panelist, Dr. Orgho Mukherjee, Senior Consultant and in charge Onco Anesthesia, Perioperative Care and Pain Management of Medica Super Speciality Hospital, Kolkata. We have today Mr. Shantanu Chakraborty, founder, trustee, and chairman of Ruma Avedana Hospice, which is established in 2002 in the name of his beloved wife Ruma, who unfortunately passed away in non-Hodgkin's lymphoma. He is also a renowned professional musician. He is the initiator of music therapy in Chittaranjan National Cancer Institute, and also he is working in his hospice with this music therapy in Chandanagar. Today we also have Ms. Madhurya Roy, founder and instructor of Fit Version of Life. She is a professional yoga instructor and she is guiding many people towards a healthy lifestyle. We are fortunate to have Dr. Anirban Pal, Assistant Professor, KPC Medical College and Hospital. He is a renowned pain physician. Not only that, he is a great enthusiast for mindfulness practice and also international certificate holder for mindfulness. He will be joining us a little late. Let us start our discussion today. As Dr. Krishna ma'am, Dr. Unrak sir also discussed, as a pain physician, we treat our patients with medications, interventions, sometimes some physical therapies, lifestyle modification. Sometimes we suggest them occupational changes, but we feel these are not enough. So my first question to Dr. Orgho Mukherjee, from a pain physician's perspective, when do you think of referring any of your patient to any other supportive therapy or care?
Hello, good evening, everyone. Good
Good
evening,
evening.
national faculties and dignitaries and common people also. I think you have to switch off this sound.
May I request all the others to please switch off their mic so that our esteemed panelist, Dr. Orgho, is talking about something so we can hear, everybody can hear that. Thank you.
See, going to the basics, I mean, why chronic pain management is difficult. We all know that during chronic pain, there are certain changes in the spinal cord and brain at the receptor level, and which actually not that permanent, but it's a kind of semi-permanent kind of thing happens once this chronic pain happens, and that's why it is very difficult to treat as such for chronic pain. Now going through the definition of IASP by pain, and it clearly indicates the psychological part of the pain. Pain doesn't mean it is only the physical part. It has got an important psychological impact. Apart from that, there are other aspects also, like social and emotional aspects of the pain. Now certain pain in when we see the patients in OPD, certain pain, most of the patients in India and in this part, east, at least in eastern part of the India, we face in the acute phase. That means the patient comes with a severe kind of pain. Otherwise, I don't think the patient, they normally come for a chronic phase of pain. So they usually come to us with the acute phase of pain. But at the background, when we ask them the history, we can see there the pain has been started sometimes 6 months, 8 months, 2 years, 3 years, even 10 years. And then he has or she might have gone to different doctors for different therapies, and still that pain is uncontrolled. So when we start with dealing with these kinds of pain, we start to focus on the what are the root causes, what are the causes of pain. And then we can find that there are certain pains that where the cause can be easily found out, and the there might be some physical treatment, for example low back pain with some disc procedure or some other procedures. So then you can do that certain specific treatment. That means certain specific uh, treatment which is going to treat the root cause. But some pains are as well there where the specific reasons are unknown, or it is said that those pains are very difficult to deal with, like neuropathic pain, like fibromyalgia. So in this case, that all the modalities to come together to take care of that pain. All the modalities, what are the modalities? That means the physical part of the pain. That means there are several procedures, maybe pharmacological, maybe interventional, as well as the psychological part. That may be counseling, that may be yoga or mindfulness, and along with that relaxation that patient needs. That means when these patients are catastrophized, that the term catastrophize is mentioned in many times in literature. When the patient is catastrophized with pain, and when the patient is feeling helplessness, hopelessness, these kinds of situations, we definitely will start taking help all those therapies along with the main physical pain therapies.
Thank you, Argoda. We'll come to you again later. Now let us learn a little bit about the music therapy. It's a new thing for us, and we are fortunate to have Mr. Shantanu Chakraborty here with us today. Music is something that helps all of us for stress relief or when we are happy every time. And nowadays, many studies are also showing that music has a therapeutic role also. So, Mr. Shantanu Chakraborty, good evening. My question is, I know you are working in your hospice and in Chittaranjan Cancer Hospital. So, in which group of patients, in your experience, you get the maximum benefit from music therapy? Hello.
Sir,
Mr.
you
Shantanu?
should unmute yourself, sir. It is mute mode.
Yeah, can you hear me?
Yes. Now
Yes.
Good evening, all, and thanks a lot for allowing me to join in this discussion. Now I would like to say that we have tried music therapy only with the group those who belongs to palliative care. So whatever I will say, it is not that we have tried with any other group of people or having pain with other situation. So we are mainly working with palliative care since 2002, and what we have done that whatever experiment or whatever research, whatever we have done, that is only with the people who is referred for palliative care. So mainly they are terminally ill patients.
Therapy or how one-to-one sessions or is a group therapy? How do you do that?
Yes. So what we found, I mean, I do believe that there will be a time when we will be able to do the individual one also, or like trying to give the therapy one-to-one position. But what we found as we started that, because we did that in Chittaranjan National Cancer Institute before COVID, when we used to give them individually. We used to ask them to come individually and sit and to have a music therapy, go with it. But what we found, there are times, there are people who really like to have in that way, but most of the cases, like when a patient is coming with having terminally illness, which means with having different kind of psychological and physical burden, if you ask them in their first sitting, just sit on your own and come and sit for our music therapy, they generally get feel, like feel alone. They said, another thing will happen, something like, am I going to have another operation or something like that? But once we started that after COVID in Chandanagar IP in the inpatient hospice, when we asked them to come in a group, and as they are admitted in that hospice for a certain period of time, the first thing they think that we will go get together there and will listen something. So it what we felt, it is more acceptable for them if we ask them in a group. Now I can't say that this is the best way, or asking them alone is not the right way. But this is what we experienced, that initially this is the good way for them to get involved in music therapy. We do have a plan that that everybody, after getting music therapy in other days, if they want to have listen on their own, want to go with the therapy on their own, that we might start that. But at present, what we felt, when they come in a group, it is more acceptable for them to accept this therapy and to sit and listen, or to lie down and listen.
So, how do you manage? It is yeah, your own composition, or what kind of music you choose? Is there
Yeah,
choice of the patient, or how you
that's
conduct that?
that's a very important question. I mean, if we just Google, sometime we might find that certain precise music, certain precise ragas, they are recommending that these things help in certain, what I would say, certain with certain symptoms. It helps much. Uh, it was from the beginning in my mind that, do we really compare with other raga and other music with the same symptom? Probably, as a whole, music therapy never got that much chance to compare with the same symptom, same disease with same raga or other thing. So we try to find first that when a person likes the music the most, like a common person, those who are specifically trained in a specific part of music, right? For them, they can choose many things. Like somebody can say, I like only Western classical, somebody can say, I like only Indian classical, and so on. But a common person, what we found, they first, people get attracted to a good tune, and if it comes with a good word, then it also give them a more attraction or more interest. But if you consider, in your past days, if you hear something from a long distance, you will feel first we consider it is, if that tune suits us or not. And recent studies, what I got, the research is telling music therapy with known songs or known tune is much effective or more effective than you know some tunes which is we are not used to it. Now let me explain in a proper way, that if somebody asks me to listen like a typical kind of a typical classical, any music, maybe from Africa, or from even from south part of India, or from another group with which we are not used to, it might struck me, but I'm not sure whether I'm going to be what I would feel a pleasant state of mind with that or not. It will depend. But if something I hear which I'm used to it, that actually helps me a lot to either to concentrate or to get some interest to listen towards it. So what we do, it's not that I only myself play the music and ask them to listen. We choose different group of people. They are from Indian classical music. They are from other Indian music, group who are well known uh, for our past profession. I have an access to them, and we made them understand that what we want is they need to play something which will be easy music, not something I once I will hear, I have to think a lot more to understand that, which will be soothing and which will be with a simple kind of beats if they want to use the beats. So we start with this process, and then we gradually goes as we see how the patients are reacting.
All the patients are not possible that they will be your inpatient department. So the patients who are outside, they also can join or online, or is there any option?
We haven't started online thing, I mean, yes, we can start. We have a we have a we have a plan, to start online thing. But those who wants to come, those who are admitted and those who wants to come, they are always welcome. And what another thing what we find that something, if you can see and listen, that makes much more difference than something if you just hear on your ear but you can't see anything. I mean, yes, those who are serious music lover, they definitely will be able to connect in that way very very well. But those who are not that much seriously, into music, but those who are just a patient, normal general people, we found if they see something is happening in front of them, that makes a big impact. Just like if you go for a live program and if you just listen the same song or same music putting in your cassette or like that, or in the CD.
Yeah, sure,
Dr.
definitely.
Sukhdev Naik sir has raised his hand. He wants to
Yes, yes,
comment
sir.
or ask something.
Yes, sir.
Dr.
Yes, sir.
Naik.
Thank you, thank you. Actually, it's very good that Dr. Santanu Chakravarti is doing good work, but I little differ from him that yes, if something is happening in your front and you see and that you get involved, but if you also send something on virtually, and if the patient sees in his mobile or his laptop and listens it in the ear, that also has got effect, because many centers they conduct online music therapy, and it is effective because it is a question of mind that yes, you are imagining the things, you are seeing something and listening. So that is also possible distantly also. Of course, if you are there, you can instruct, you can, but virtually also it is possible because music is very soothing, and our brain, our hearing comes very fast and goes last. Hearing is starts in the womb, and to the last few minutes before death also the listening is there. So it's very basic sensorium that our nature has given.
Yes.
I think if you are doing good job with your patients physically, I think you can try from Kolkata, other centers also, and if you can have a session, they will join you, and they will have good effect. Because I have practiced this Om chanting, and with medications, with whatever therapy, and even in our emergency wards, patients are listening the Om chanting in their ear, and treatment is going on. It has got a tremendous beneficial effect. Of course, we have not published it, but we are going to publish because lot of parameters, tumor markers, sensory markers are reduced in once we listen to the music. So I think you can. My suggestion that don't keep only a patient is in front of me. I'll give. You can try that. You are working in CNCI.
Yes, yes. And I must say, you are absolutely right. What I said, we haven't tried that yet. There are some other things, issues are there, like financial issues also are there. But we do believe that what we are doing, having somebody in front of us, why not if we can try to send through air? I mean, so we do have a plan, but we haven't started that yet. That's what I say. Yeah.
Thank you, sir. It's a really nice suggestion, and
Yes.
sir, please take it
Yes.
in future.
Yes.
And can you share any of your experience with such patient, how they have reacted?
I mean, see, are you asking me?
Yes, I am asking
Yes.
you.
See, I can give you some example. I mean, we have recorded that we do have some photos like that. We do not have any exact explanation why it happened. In Chandannagar, when we were in on the position of playing the music, just 1 month starting, they brought number of patients. One of them she came with a wheelchair with having an oxygen concentrator, mask on her face, and she was just lying down, with the head was completely lying down, and it seems she doesn't want to come. I mean, she didn't want to come. It seems like that. And we, on the other hand, were sitting there, and we were thinking why they brought this person. I mean, for us also sometimes, like if somebody sits in front of you in a negative way, how you will feel to at least to play a music. So anyway, we ignored, but still we thought better she would have take rest in her bed instead of coming with the wheelchair. Anyway, the music therapy was on, the music was going on. It was a live show. We found she was within 15 minutes she started sleeping. That what we found. So she laid back, everything was there. We found she is sleeping. And our nurses and palliative care specialists, they were always there, taking all their reactions, writing down pre, post, all those assessment was going on. So I found they were also doing something with the oxygen concentrator. Anyway, after 45 minutes, that session stopped. So we were, and before that, we said repeatedly, those of you who want to leave the place before we stop, you are very much welcome to do that. And all those things, we already said that. This woman just like to us, she wake up kind of like that. She just put his face up and say, I want to listen more. We thought, what is going on? And it is documented her oxygen was, I think, 5 liter per, that thing was there, and they actually reduced that oxygen flow, and she was completely fine. So I cannot explain what exactly happened to her, but the reality was she was completely fine. Now this is one example I am giving. Within last few months, we found at least 2 to 3% who we thought they shouldn't be brought there. They should be lying in their bed in their in their room, and they actually surprised us. So this I can give you the example. We do have all those photos, and obviously the research work is going on. So obviously we will at some point we will put all those things. But this happens. And I must say, if we say that this particular music did the thing, it didn't, because I have some chart. Every time we actually, on purpose, we changed the ragas, not exactly pure classical way. It was a mixture of classical and a little bit of modern type. So it was not precisely one raga or one music did the this change. It was the music that suits them, that soothes them. I think that makes the change.
Thank you. It's many studies have also shown that music has a role in AWEC surgeries. Or Dr.
Yes.
Dr. Shani, you are in the mute. Please unmute yourself.
Can you hear me? Yes. Many studies in recent times have been shown that music therapy has been also used in some AWEC surgery patients, critical care patients. Also, there are studies are there. So, Dr. Orgo, do you think chronic pain patients can also be benefited from this music therapy? Can we try it?
See, I don't have right now. I can't say that I have much experience in it. But yes, of course, literature suggests that not only chronic, even acute pain sometimes works with music therapy as well.
Yes, acute pain. Yes, operation theater also sometimes we are using music therapy in awake surgeries. They are doing. I have seen also in internet also, but there are studies going on. Moving to our next topic. As a pain physician, we all refer our patients to various forms of exercises. Dr. Orgho Mukherjee, I want to ask you, before referring a patient to yoga or any kind of this type of fitness therapies, how do you want to counsel your patients, in chronic pain patients especially?
See, this is the most difficult part. I
Yeah,
want to
I
tell
know,
you.
I know.
Because every patient, as I told beforehand, that patients are coming in acute phase. Okay, even if the patient is has been suffering from 3 years, 5 years, or 10 years, he's first time coming to me, or maybe after 4, 5, 6 doctors, he is only coming to me at acute phases. So that time it is very difficult to make them uh, ready to accept other forms of therapy apart from the physical form, right? So after just what I usually, so just after one or two visit with some kind of physical therapy for physical pain, I usually started counseling for these kinds of chronic therapy, mostly mindfulness, as I know Dr. Anirban and him for a long time, and we are working, and psychological therapies, and yoga, of course. So I don't know, I cannot say that this is a correct approach or this is the only approach, but this approach is actually works, because after uh, some relief from the acute phase of pain, when the physical pain score reduced maybe from 7, 8 to 3, 4, then these kinds of acceptability is more in patients to accept this form of therapy, because of two reasons. Number two, the therapist is changing. I mean, the second person, he has or she has to attend a second person. And number two, of course, that is also, that needs a professional fees. So that thing comes. So what I used to tell them that, see, what is your problem, that problem is not going to be solved by the current therapy I am providing to you. That is definitely not going to help you, or if it is not a curable, but it may give you at least 60-70% relief in your pain. It may not be curable at the end of the day, but yes, it will give you at least 60-70, or maybe sometimes up to 80% of pain relief. But you have to continue both the form of therapy, that means all these kinds of unconventional with some physical therapy as well, Dr. Shani.
Hmm. Madhurya,
So, Dr. Shani, I'm just interrupting, as
yes.
so many common people, as this is an awareness program.
Mhm.
So common people, maybe from West Bengal, outside also. So, can
Yes.
you just do a nutshell in Bengali, so that they can? It is being easier to understand, just in a nutshell. So,
Ha,
Mr.
ha.
Shantanu sir has told so
Sure.
many things, and Dr. Orgu has enlightened us with the acute pain and little bit of chronic pain patient.
হ্যাঁ 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 থ্যাংক ইউ। হ্যাঁ, নিশ্চয়ই। আজকে আমাদের সাথে অনেক সাধারণ মানুষও আছেন যারা জানার জন্য এসেছেন। তো তাদের জন্য আমরা যা আলোচনা করলাম এতক্ষণ, পেন, ব্যথা, শুধু ওষুধ, বিভিন্ন যে ফিজিক্যাল থেরাপি বলি, যেগুলোকে কিছু এক্সারসাইজ বা কিছু ইনজেকশন অপারেশনের দ্বারা সবসময় সারানো বা কন্ট্রোলে রাখা সম্ভব হয় না। তার জন্য আমাদের আরো কিছু কিছু পদ্ধতির সাহায্য নিতে হয়, যেগুলো শুধু মুখের কথা নয়। আজকাল বিভিন্ন রকম স্টাডিজ যে এসছে, সাইন্টিফিক এভিডেন্স এসছে, যাতে আমরা দেখতে পাচ্ছি যে আমরা এতক্ষণ আলোচনা করলাম মিউজিক, শান্তনুবাবু মিউজিক থেরাপি নিয়ে কাজ করেন মেনলি ক্যান্সার পেশেন্টস এর ওপর। সেই মিউজিক থেরাপিতে উনি যথেষ্ট উপকারও পাচ্ছেন এবং ওনার স্টাডিতে সেটা উনি পেয়েওছেন। আর এছাড়াও অনেক সায়েন্টিফিক এভিডেন্স এখন এসেছে বিভিন্ন রকম অ্যাকিউট পেন, মানে অপারেশনের সময় পেন, যারা আইসিইউতে ভর্তি থাকে পেশেন্ট, তাদের উপরেও মিউজিক থেরাপির রোল আছে, সেটা আমরা পেয়েছি জানতে। এখন আমরা আমাদের নেক্সট টপিক যোগা। আমাদের সাথে আছেন আজকে মাধুরিয়া, উনি যোগা ইনস্ট্রাক্টর এবং ন্যাশনাল ইন্টারন্যাশনাল সার্টিফিকেট হোল্ডার। তো ওনার কাছ থেকে আমরা একটু যোগা সম্বন্ধে। সো মাধুরিয়া, আর ইউ দেয়ার?
Yes, I'm there. Hello.
Okay.
Hello. Good evening,
Hello.
everyone.
Good evening. Good evening. So, why yoga is not just about fitness? It is different from other form of exercises or anything. So, how it is related to well-being of a person or a patient?
This is the thing. Actually, yoga is totally different. Yoga is like, according to me, yoga is a disciplined lifestyle. So, yoga is not only about asanas. It's about being positive towards self, and it's about being positive towards society. Like today, we are gathered here. We are already practicing yoga. Okay, so we are spreading knowledge. Without any expectation, we are spreading that knowledge only. Okay, so that is also yoga. So the connection, the community, the union, that is yoga. So yoga is not only about asanas, like we are practicing asanas every day 1 hour, that is we are practicing yoga. Absolutely not. If we are in a disciplined lifestyle, that is yoga. Okay, yoga is a vast syllabus. I personally suffered from neck pain, from low back pain in my teenage, because some posture and anything else, and also some physical problem I have there. So my doctor suggested me to start doing yogasan, and then after some periods, I came to know the vast side of yoga, where there is philosophy, there is yoga history, and many more things. And then I starting doing swadhyay, like I am starting doing self study in that day. And then I came to know that from by practicing yoga, it can help to improve one's mental and physical well-being. And also I believe that if we train our mind in a positive way, then it can help to resolve the pain. Physically we can be fit and more active. So now I come to the point of asanas, because we all know yoga is equal to asana. That is the now thing, the very common thing, that yoga, that means we are practicing asana. So now I come to the point of asana, that is very little thing in a vast syllabus in yoga. So where we teach students to focus on their muscles and their joints to build strength and mobility. And also in yoga philosophy, we have 7 chakras, and we also say that the 7 parts of our body, the main parts of our body. So if we engage those 7 parts correctly, then we can improve our physical health, improve our mental problem, and also we can heal the pain in that particular areas. Okay, so the 7 points is very common points. That is the crown of our head, that the one. Second is the third eye. So third is the throat. Fourth is the chest. Fifth is upper abdomen or the navel area, and sixth is the lower abdomen area, and the last one is the pelvic plexus. Okay, so these points, if we have these points, if we have engaged properly, then definitely the pain is going improving, and all the thing we can improve ourselves physically and mentally also. Okay, so yeah, that's how yoga and well-being is getting together day by day.
Dr. Piali, can you please mute yourself?
Yes. Coming to our today's topic, uh, you often, as a yoga instructor, you definitely often get patients with chronic low back pain, joint pains.
Yes.
So first thing I want to know, how do you motivate them?
Hmm.
Because they are having mobility issues.
Yes.
They will not, they don't want to try, the physical exercise. So how do you motivate them?
So that is the actual most important parts as a yoga teacher, because as a yoga teacher we are also the influencer, also the motivator. So that's why it's totally depends on student needs. Okay, because individual have individual mobility and flexibility and strength. So if any students have chronic pain, or if they can't sit on the ground or suffer from extreme mobility problem, in that case we suggest to take therapy sessions. Okay. And also um, uh, once again, can you repeat the question? That is the motivation part, right? Yeah. Okay. So we divided our classes into two different parts. One is beginners and one is advanced. So you are already said that some have mobility problem. So we insist student to choose their classes accordingly, according to their mobility. If they have less mobility, less strength, then they can choose the beginners one. And if they have the capability to do advanced classes, they can join us with the advanced ones. Okay, in the beginners class we teach them to beginners postures, teach them the beginner techniques, and the advanced we are tracking their progressiveness so that they can improve their self day by day. And the most important thing, we send them positive affirmations, we send them positive videos, so that they can see that yoga can help them to get rid of the pain, yoga can help them to be motivated and be passionate about yoga. So that's why how they can be motivated in the field of yoga.
You individualize the sessions.
uh,
Every individual, every person coming with the who have low back pain have separate type of sessions like that, or
Yes, actually, it's totally depends on the student's need. If anyone have chronic pain, then we suggested them to take therapy sessions. So we suggested them to take group classes, but we guide them accordingly to their pain. Like if anyone have lower back pain, they can't do forward bending. Like, so we suggest them that don't do this asana. Instead of doing this, do that. So we help them to understand their body, we help them to understand their mind, and we help them to understand what is actually happening to their body. So yeah, we are conducting individual session also, we are conducting group session also, we are conducting therapeutic session also. So that is how we are conducting the sessions.
so how long do you recommend this therapy for
See,
those who are taking
actually,
therapy?
yes, actually, yoga is a lifestyle. Like already, I have told that. So it's better to adopt yogic lifestyle for the entire life. And at least if anyone don't have time to practice with us, then we always instead insist them that to practice yoga by themselves, what they have learned. Like yoga is a holistic approach to everyone life. So everyone had to practice yoga with dedication, with a proper gratitude. In yoga we have a part called meditation. So as like meditation, we have also two parts, one dharana and other is dhyan. So dharana is like we have to concentrate in one object, and dhyan is like we have to concentrate but without any objective in our minds. So we recommend everyone that in according to asana we have to practice meditation, we have to practice dharana, we have to practice dhyan, we have to practice pranayama. So with a all thing, with a all of the parts of yoga, that is can build a very healthy lifestyle. So that is very recommendation, that is actual recommendation for everyone, that You have to practice yoga every day. Not like that is the thing you have to practice for 3 months. Not at all. You have to practice every day, and in for your entire life. If you don't have to time, just give yourself for 30 minutes and do what we already taught you. Them to be strong mentally, so that they can easily fight against their pains and those situations with full of positivity. And by God grace, they are improving physically, mentally, and emotionally also.
Thank you. Thank you very much. It was
Thank
really
you. Thank
enlightening.
you so much.
Thank you. Dr. Orgho, I know you are also fitness enthusiast.
Shinidhi, I'm
Am I
hearing you.
audible?
Yes,
Yes.
yes.
Yeah. So, Dr. Orgho, you are also a fitness enthusiast. So, I know. So, what is your experience about fitness and well-being?
Hapkido, that is a one ancient form of Korean martial art for six. So, as in Indian, I think the India yoga has been started in this part of world, but to yoga, and that is in other part of world. That means that came from Korea and China, then China, and this thing. So everything is at the end of the day same. The motto is same. Train yourself once and then continue the training for some and some improvement to ultimately for an enlightenment. That is the ultimate goal for every. Unfortunately, because of our busy schedule, we can practice only for once or twice a week. uh, that is the problem. Because all these things are practice dependent. The more you practice, the more you indulge yourself into it, you will improve. And once you started improving, and you will get automatically more engaged into it. At least for what is my experience, after practicing 5 in actually what is going on with me, except for some physical improvement, that is the other thing. But after 5 years down the line, and then now I started actually feeling what it has done to me, you can say. So you should practice it on and on and on, what she has rightly said. And of course, through this journey, you will feel the betterment in your life, in your attitude, and of course in psychological aspect. Dr. Shah.
Dr. Shani, please unmute yourself. So before going to the next question, uh, Runa Madam, Runa Mitra, she has asked about a question. What is the role? What role can family supporting music therapy for loved one with cancer pain? So, Shantanu sir, you are there. So
Shantanu
please.
sir.
To answer this question, I must first clarify why music actually plays a role, as far as what we understood, that why it plays a role to calm down the pain. See, one common thing is there, like if we just concentrate our thinking with a particular, kind of any problem of our physical problem all through the day and night, we will be more focused with that particular problem more than what when we end up at the end of the day we might feel it's becoming huge, even though clinically we are in the same stage. That means all through the day, if it's just for instance, if you think that I have a pain in my hand or in my knee, even though I'm sitting, not walking, but if I continuously think I have a pain, what will happen, how I will run, how I will walk, the mentally the pain will be more than the real pain what is there in my knee or in my hand. And the music, what it does, that it release that thought process from the single way to a different road, where some kind of relaxation, some kind of, good feeling we try to feel. So for to answer this in their house, or in their own at least if they can try some music which they have to. I'm telling this those who are not music therapy expert, but still how they can manage in at their home. If they can try to find thinking that I will I will care this person with music therapy, just try to think what kind of music, what kind of what are the criteria in that music that person normally loves or normally love to listen. So from there, if they can try to find some music which feels that person, at least with listening that music, if somebody gets sleep, if listening that music, if somebody can lay down for a period of time, they can start trying with that music playing a certain period of time with a soothing sound. I mean, so soothing volume, not in a high, not in a very low. So with a soothing, creating a soothing environment, and they can try.
ERI, this is supposed to be like the entire how to celebrate the Royal Event.
I didn't understand what the question was. So anyway, so if at home they can try with some music which is familiar to that person whom they want to listen, some music which is normally from the past the person some kind of music which they love. So if we, instead of making them irritated with a loud music or some kind of music, if they can make them more, feel them more calm and quiet, which will be suitable to that person, that will help. This is the initial way to do. And apart from that, if you think that, how what are the music therapists, what they are doing, we have a plan that with the same music, if we can just what Dr. Bosu was saying, that we will try to send them online, so that they can play that.
So, thank you, sir. So, there is another question from Deepanita Basu. She is having some question to Madhuri. I request her to please talk about that.
First of all, good evening to all doctors and all participants. And I should convey my thanks to Shiny for conducting this good session, and also Madhuria. Madhuria personally think.
বাট
Personally
না না
don't know
আমি
him.
আমি চিনি, আমি অবশ্যই চিনি,
My
আমি
daughter
বুঝতে পেরেছি।
Tanya, she stays in Houston, Texas. She is her student, and she has got very good result from the Madhurya. I want to say, along with Madhurya and Dr. Ordho also, that my wife, some 4 5 months, last 4 5 months, she is having the pain in the feet, both foot, due to this year. After that checking, after so many tests and others, use crystal deposition on her feet. Is there any therapy or any with the Shantanu sir also? He can also highlight, or any yoga. Definitely Madhurya can help, but Madhurya center and my house is far away. Any yoga or physical therapy can be possible for her.
Okay. I have already told a yoga therapist about that, and she will definitely look into that part. And if Dr. Argha and Shantanu sir wants to elaborate something about this, because it will be help, and we are already tried that, because মানে আমি বাংলায় বলছি, অ্যাকচুয়ালি আমার একজন কলিগ আছেন, ওনাকে আমি বলেছি তো উনি যাবেন আন্টির ওখানে অ্যান্ড উনি গিয়ে যোগা থেরাপির পার্টটা পুরোটাই করাবেন। অ্যান্ড আমি নিজে দেখেছি মানে কি হয়েছে প্রবলেমটা। তো পুরোটাই অ্যাঙ্কেলের উপর আসছে, আর অ্যাঙ্কেলের কিছু মোবিলিটিস আস্তে আস্তে প্র্যাকটিস করলে ওটা ঠিক হবে। বাট যদি ডক্টর অর্ঘ্য অ্যান্ড শান্তনু স্যার কিছু বলতে পারেন অ্যাবাউট মিউজিক থেরাপি অ্যান্ড
Now,
মেনি মোর।
one more question. That she is having that some doctors suggested that ultimately she has to just replace her knee. But I want to know is there any therapy, any physical therapy or physical any course of exercise so that ultimately the no operation or no replacement of knee is required.
Actually, I could not get your question first. Can you repeat the question? Where is pain? Where is this?
Actually, she is having the problem, you understood, due to this deposition of crystal on her both foot.
Is she suffering from gout?
Yeah, that is also. That is also.
Okay.
Recently, it has been caught. It has been diagnosed. But knee replacement, some doctors.
I am explaining to you. I am explaining to everybody. Yeah.
Okay, please.
Yeah. So see, both are the arthritis. Okay. So one is gouty arthritis, that is inflammatory arthritis, that is a part of metabolic urine metabolism. That is can we say that it is a breakdown part of protein. What protein we are consuming, আমরা যে প্রোটিনটা খাচ্ছি সেটা বডিতে পিউরিন মেটাবলিজম পাথওয়ে দিয়ে বেরোয়, এবং সেই পিউরিন মেটাবলিজম পাথওয়েতে যদি ডিফেক্ট থাকে তাহলে দিস ফর্ম অফ ক্রিস্টাল ডিপোজিশন হয় এবং সেটা গাউট হয়, সেটাই আমরা গাউট বলে জানি। এটা একটা এই আর্থ্রাইটিসটা ইউজুয়ালি এফেক্ট করে গ্রেট টো এবং এইগুলোতে, মানে পায়ের স্মল জয়েন্টসে। Whereas knee osteoarthritis, it is a degenerative arthritis. It is a different types of arthritis. So approach for both these are different. I mean, the physical pain and these things, the treatment for the physical modalities are different. Along with that, yes, nowadays I'm not going into the detail of these both the arthritis. Physical modalities are there. Even without doing TKR, pain can be reduced. But remember that osteoarthritis, actually there is a loss of cartilaginous part in the knee, inside the knee. Okay, that regeneration cannot happen. That means whatever the therapy you can perform, the regeneration inside the cartilage is not possible. So pain can be reduced, but it cannot be zero. You have to accept that thing without surgery, because TKR or whatever the surgery is recommended, that is the recommended number one treatment for knee osteoarthritis. Okay, so when you are doing TKR, that is a surgery, you are removing the whole knee and you are replacing with the artificial joint. That is a surgical part. What we are doing, we are providing other forms of treatments like radio frequency ablation of the nerves around the knee, along with some kinds of PRP and other regenerative therapy. But the stress and the psychological disease can be well treated with other forms we are discussing today. And the mobility part, the mobility even with the defective cartilage, that by yoga. I think it is clear right now. So
yes, but
yes,
tell me.
And for gout, it is a physical modality of treatment which is enough. There are medicines, you have to take these medicines long time. You have to take this medicine, as it is a it is a defect in the metabolism. So you have to take this medicine for long, and then obviously the pain can be controlled.
but
Sorry to
totally,
interrupt you.
fully
I'm sorry to interrupt you a little bit. We will
Sukhdev
go to
sir
the
has
question answer session. Sukhdev sir, please.
sir
Sir,
wants to
Sukhdev sir.
say something, sir. Please,
Okay. Okay, thank you.
sir. Please unmute yourself.
Sir, can't hear you. Sir,
Actually, yeah, now can you hear me, please? Am I
yes,
audible?
yes.
Yes, yes.
Actually, our science is evolving. Our science, to get told many other things. If you put together and give our allopathy and other things, maybe things work much better because our brain is highly perceptive to many other things like suggestions, music, all these things. So I have got two experience of two cases where about middle-aged ladies, about 57, 60. One had got very severe knee arthritis, and the other had got also the column at the level of L4, 5. Again, both the cases, the surgeons, normally they'll say, go for surgery, like widening the canal and putting, and I was also, because I also like Dr. Sayani and Dr. Arge, I also try to give them, if we do non-surgical method, because if you do surgery, you're cutting away and you are destroying what the God has given. So if you can do with what the God has given and then put some Ayurveda and other things. So to my surprise, these two cases, there is another Central Institute of Ayurveda Research just in front of my college. So out of query, I just asked the professor, the research officer, can I? And they sent, and you'll not believe me that both the cases in one therapy, they get admitted for 10 days and some therapy and this kalpa and all the things, panchakarma. And both these cases, the improvement, I asked because they came to me, I had recorded the VAS score was 10, severe pain, they were not able to walk. And after the therapy, it was, usually it was 1. So 90% relief of vascular, and the patient was telling within 10-15 days. Don't disbelieve the patient. Of course, there are two cases, means very similar cases, very less number of cases to predict. But I think we have to have an open mind. Let us give other therapies like music therapy, as Dr. Arga says about the physical therapy and other therapies. Our benefit is the patient should get the benefit. There should not ego that just I'll just give blocks and then I'll forget, I'll give medications. So if you keep our mind open and give other modalities of treatment, probably multimodal therapies is best for the patients. And I'll be referring more patients to them, and let us see if you can give combination of the therapy, what is the outcome. Thank you.
Thank you, sir. Last topic, and at the end, we will again come to our question answer session. Mindfulness. Our last topic is mindfulness. This is something, according to my knowledge, we all should practice, but we don't do. And nowadays, it is proven that it has a therapeutic benefit also. So we have today Dr. Anirban Pal. Good evening. Dr. Anirban, good evening.
Good evening. Am I audible?
Yes, yes, you are audible.
Thank you. And
So please, please enlighten us. When we are talking about therapies of mind, screen them when they come at fast for your therapy. Do you screen them?
okay. First of all, my gratitude to WVSSP for inviting me as a speaker in this beautiful discussion that has been going on with the different therapies. And we could get different perspectives of different modalities, which can as well as palliative patients. So coming to mindfulness, the question is that which group of patients should be referred for. The pain physicians, they are very interested to know about this, and I am also a part of them. Which type of pain this therapy works. Now, I have been working with mindfulness since 2016. So it's quite a long time, nearly 9 years now. And I've been training people with mindfulness for maybe around 6 years. So what I have found in my personal experience is it is not the type of pain, or it is not that particular stress level or something like this which is actually coming into the play. The main thing which is there, that the patient or the person, I would like to say as a human being, the person has to be open minded. Just before referring to this open mindedness, so a person has to have an open mindedness, that that person is eager to try this thing, and also there has to be some amount of faith in this, that I am getting into something, so let me try and explore and have some amount of faith with the mentor, and some new things will be coming into my ways. So let me just try this and have faith. And because in today's world there is a major problem with most of the people coming into this alternative therapies or these things, is today we are living in a super fast age, in a modern, so-called modern age. So when if you want to have a pizza, so you just press a few buttons and the pizza arrives at your home within 15-20 minutes. Okay, so whatever food you want, you just get into a food app and you just get it in 15-20 minutes. So people have that same expectation with these sort of things, that okay, I will be starting with this, and obviously the things something magic is going to happen. Unfortunately, the thing is not like that. I just remember Dr. Orgo has referred a patient to me, and the patient called me and said that he has referred. I said okay, so we will be starting with your therapy, no issues. So next maybe after 2 weeks we'll be starting with the sessions of mindfulness or something like that. Then he said that sir, can you just give me something for the 15-20 days that are left before the therapy starts? I just said that okay, there is nothing like that, but you can prepare your mind for whatever therapy or whatever mindfulness is coming for you. You can just I can send you a music. Just take out 10 minutes every day and just listen to this music. Okay. The next day, this person again called me, and this time he said that sir, you have given a music to me to prepare my mind for some mind therapy, but I am feeling no difference. Okay. So I said, how many times you have listened to that music? He said, I listened to it once. So I told him something which you, Nuria ma'am, was saying to this, that it is a lifelong thing. It's something which is very slow, but which is very, very effective also. So you have to be, you have not even started the therapy, and you expect that it will be just decreasing my pain and it will take away everything. So that is not the case. So my personal suggestion will be that any patient who is open minded and who has a little bit of faith in whatever therapy he or she is going to try is a good candidate. Okay, it is not that particular type of pain. Obviously there are certain types of pain,